This part of the exam is the cerebellar or coordination exam. There's certain important foundations to remember before I demonstrate the exam. One is you always want to do the cerebellar coordination after motor, because if someone is motor weak, they're going to look clumsy. So you always want to remember that, because if you do the cerebellar coordination before motor, you're going to be very confused and localizing and figuring out where someone is. So just remember that. Sometimes if someone comes in and says that they have tremors and they're dropping objects, your tendency is wanting to just get right to it. You want to do the sequence of the exam in the proper order, because all that prior evidence is going to help you figure out where you are and where you're being in the neurologic exam. Some important other aspects you need to remember is pain can influence this exam. So if someone has a frozen shoulder, like a tight shoulder, they're not going to be able to have full extension of the arm to execute. You want full arm extension to do finger, nose to finger. So the patient needs to have their arm fully extended, so a frozen shoulder, restricted joint, and that includes you. We're often sometimes very gentle with the patient, that we don't always have them extend their arms, so their arm needs to be fully extended. And same as we're doing rapid alternating movements, that pain, joint restrictions, people with osteoarthritis, rheumatoid arthritis, you're going to have issues of those patients doing the dexterity movements. You want to be mindful of the fact that someone has arthritis, they're not going to be able to do this. When you're doing rapid alternating movements, we're always very focused on how rapid it is, but you want to see how much they freeze the other fingers. If someone has the inability to freeze the other fingers in executing these movements, that has relevance. So where they land the fingers together has importance, and then each finger. So if someone, let's say, has left hand symptoms, start with the side that's not impacted to get a good idea of what's going on. Also focus on how big the velocity or the magnitude of the movements. People with Parkinson's will have small movements. Another important thing you can do is the hand clapping back and forth. Someone who has abnormalities, it will be softer and quieter. You'll actually hear the sounds versus quieter. And the other movement is one for dysdyskinesia. Someone who has abnormality, you'll see slowness of movements versus rapid movements. So again, motor first. Be mindful of joint restrictions, arthritis, and pain. You want to pay attention, besides the area of focus, how much the area around the movement that's being checked, for how much freezing of the other areas of the digits and the joints happening. All relevant information. So we're going to get down to the legs now as the next area of focus to give you guidance before I demonstrate the exam. Okay, when we get to the legs, some other mindful points are if someone has hip disease, knee injury, knee disease, arthritis, you have to be very mindful again that that restriction can cause problems doing heel to shin. Someone who has leg weakness will affect this part of the exam. Someone who has rigidity, spasticity, dystonia, they're not going to be able to execute this. So do your mental checklist. Can these be factors that can influence this? So when you do dysmetria testing, you must often demonstrate to the patient first, because it's a very odd task. So the heel goes on the shin and slides straight down. It has to be straight as an arrow. Weaving could be abnormalities. So you can imagine someone has a hip injury, like in the hospital you're seeing, or someone has really bad arthritis or dystonia rigidity, you're going to start automatically seeing this weaving back and forth. And it's going to cause artifice. So if people cannot do that because of immobilization, they're in the hospital, wheelchairs, bedbound, there can be other ways you can probably compromise, where you can actually have them maybe touch your finger with their toe. It's not as ideal, but it's a compromise. Sometimes I have people actually just draw with their toe a straight line. Again, not as ideal. It should never be used besides the heel to shin. As you do rapid alternating movements with your fingers, you can do toe tapping. So people have extrapyramidal disorders, cerebrovascular disorders, you can actually hear toe tapping, and you can pick up side-to-side difference. Someone who might have extrapyramidal disorder, you'll hear one side's very quick, the other side's very slow. So these are tips on how to think about where you might see variability, false positives on dysmetria testing in the arms and legs. And now I'm going to be showing you on a real person how to perform coordination cerebellar testing. Thank you. Okay, I'm going to need you to take your right index finger and touch your nose, and then touch my finger, and then touch your nose, and then touch my finger, and then touch your nose. Good. Now we're going to do the same thing with the other side. Touch your left index finger, touch your nose, touch your finger, touch your nose. Good. One more time. Great. Now we're going to do something here where you're going to take your index finger and thumb, and you're going to actually just do this little pinching motion. Great. Now can you do each finger? Great. Now the other hand, can you do it? And you can actually see that you're right-handed because your right side's actually faster. Perfect. Now I need you to take your left hand and just tap it. You do your right hand first. Good. And now the other hand, do the same thing. Good. They're equally good sounds. So what you're going to do is you're going to take your hand and go back and forth like this, each hand like that, a few times. Now switch hands. Excellent. And the last thing I want you to do is you're going to make some circles going forward. Either hand first. Excellent. Now stop and then go the other hand now. Great. Thank you for doing this. Everything looks good. I'm going to need you to take your right heel, place it upon your left kneecap, and slide down your shin. Great. Thank you for doing that. Now I'm going to have you do the same thing with the other leg. Take your left heel, place your left, slide down. Perfect. Now I'm going to have you tap your left foot for me as fast as possible. Good. Now your right foot as fast as possible. Thank you.